cosa, professeur. Bonjour. Asseyez-vous. Bon, sinon, bismillah, très rapidement. Après, il y a une deuxième.
Après revue des données épidémiologiques, entomologiques et cartographie, nous avons l'agréable plaisir, Monsieur le ministre, de vous informer que la transmission de cette maladie est éliminée du Niger. Je n'oublierai pas l'infatigable membre comité de l'élimination de l'onchocercose. J'ai cité ici le professeur Daniel, qui est toujours à nos côtés pour nous appuyer, pour nous accompagner.
I started working on river blindness around 1976 as an intern in Ghana. After graduating, I joined the onco control program in West Africa. And we used to do river prospections using helicopters. And these were used for spraying insecticides. And here, behind my microscope, as a cytotaxonomist for the onco control program. And here you can see the OCP vehicles lined up, getting ready to go to the field. For almost 50 years, I've been working on this same project. It is quite gratifying to see that one can get to a situation where countries are now going to eliminate onchocerciasis.
Le programme ministère santé o wala mun féliciter quoi déjà yi mo jakka hen goto fo excellent donc yi on est collé o jaggi goto keso effectivement o kadi ko simelin quoi donc o winday mbo e odo donc mi kadi aussi c'est bon il y a la qualité remplie point o ari en 2017 o ari do mi ati do bade choix de sito donc kanko mo ar semaine garowo salla a jaɓi mardi ou mercredi to ari kadi mi waɗi walton o golle ko expert international ko expert OMS onchocercose professeur Daniel Bouaki o ar so ari appe o yewtude on o waɗi mon expliquer Sénégal holko woni fandare mabɓe oto tolnuɗen élimination mais wallito laltol so nani mo lamde o jarama kadi ko golle ɗe voilà bon on va aller il va vous motiver un peu.
Onchocerciasis is transmitted by the black fly Simulium damnosum. Blindness results from invasion of the eyes by skin-inhabiting embryos of the roundworm Onchocerca volvulus. Breeding occurs in many narrow streams. The larvae appear as black patches on rocks, leaves, and twigs.
But these are very newly hatched larvae. It will take about 5-6 days for them to get to be a pupae. They are very tiny ones. Yamusa is one of the communities that we say is at high risk of fungal. And so a community like Yamusa, you can assess to show that your medicine is working. The fly breeds in these river valleys. They come out and they bite people. If you have somebody who is infected and they are bitten by the fly can pick up this infection. And so if you check the fly, it's critical when you want to prove that transmission has stopped. The fly collectors are your call to show that you are achieving results. We cannot be free of all diseases, but there are some neglected tropical diseases. They can be prevented.
Ada kalanga. Kalau anak ono.
Abu Daki Cerno. Abu Oro Cerno.
boo gisee loolu puisque xam naa ci dëkk bii la dëkk te dama di jël volontairement fàttali ku liggéey boobu dañ ma newoon daa am feebar bu ñëw loolooy tax simili yi ñoo indi feebar bi
ko en 88 ɓe ari haa ka jowro ari on wattu ko baaba woni jowro ɓe yewdi e makko ɓe yo noddu population on ɓe jooɗoda ɓe suɓanamo yimɓe nayo jeeyaɓe ka saare ɗo ɓe waawa formude ɓe
lañne 7 heures ba 13 heures nga wàcc nga ñëwaate 14 heures ba 18 heures loolu yombul ay décision ferme ngay war a jël ci liggéey boobu et en même temps volontairement la
mais ngala cuude ha ƴakka si ari tu a keppaymo ɗo itta ferma watta on noon ka jiifama wat etta goɗɗo kadi habboɗa singi ari berko ari o berko ari harangi yarali ƴiƴam maɗa par ce que singi ƴakki te ñaw o ala yeeyde ɗa ceno ha ngi ƴakkuma wakkilo on attuɗa ngi nanngude haray mi wata accide goɗɗum ka ɓandu ma
eyi yo fayda miijo heewata e mum ɓayre haray jomum kay miijo kay si iwi ɗo haray jo peut être ko si yeeyo programme ji mum kono haray ɗo alhamdulillah
ga kay si min ari ga haray meɗe woni ga no waɗani mi wula no deeƴi meɗe miiji kadi fi famille on ka galle par ce que sa yimmi hedde 7 heures bim ari ɗo ha 18 heures a hotata ka galle iɗa ga ay téléphone a huɓɓata pour wiyaɗa ɗum man fayda si probléme heeɓi ka galle toon an a andata si ana ɓe itti goɗɗo ɓe délégué ari ha tawma ga haalanma a wata ande kon ɗum feƴƴi ka galle ma
mbiɗa andi miɗo acci ɗo ɗo mi iwde to wode ko mi acci toon ɗo komi miijoto ko simi ari ko honno mi heɓirta ɓare simi ari comme no hendu ndu woni waɗirde ni mugo jiɗi no metti heɓude
ɓay meɗe wulɗa kay ɓayru ɓe ni a fota heɗade radio ga a huɓɓata ga yiite a fimata ga cigarette a fota wonde kadi ka yimɓe ɗuuɗi par ce que brouillon si yimɓe ɓen ɗuuɗi no wawi kadi ɗi salon jippade no woodi par ce que allah wiyen ka qur'ana ko kullu muslimin ikwatu fa asinu bayna akawaykum a nangi jele Souley ay ande no mbayre hen ɗum ɗo ɗuuɗi allo Ongai Hus.
Mau veho tu ka plus mungkin. Mari.
At the beginning of the program, there were places where at least 20% of all adults, especially males, were visually impaired. Now you go to communities, and in places they say, oh, do you have is uncle still there? Which means people are completely forgotten. The children will now have the opportunity to go to school without fear of the future being blind or losing their eyesight. This old man that we went to see is most likely one of the last people who have had this worst form of the disease.
Ani sita innel be kahuri kulu ko jongo to konko tingom bonte bole salna mbe nyaalo chori haro ko mama kama tema ninkele isa ko nin kurumbitale nata jebe la piso ne dula ke ka korosina bebe kurari asetonya anga soto wolu na ame o hase se tamna se tomole me ni pulitimingo ni ndo bebori mo harbola hinkin telbe keri ne bas ni se ibeni la kilena no akun dimin ate diminna o halanga fisa.
The good news is that now in Senegal, the disease that is called river blindness, the disease is almost completely eliminated. We are happy because now the children are not going to have the same problem with the eyes. When we talk of the disease, we know that he is one of the people who was able to help us understand the disease.
Merci ngana na kali tay ni sege. Wow. Ikan na to bom janna. Ini sege dia tanya la mun be si maya la ka haji gali fini.
Seeing the man as something that reminds us of how it was. When I was an intern, and we go to villages where you have the disease, you have a lot of the adults being blind. It's sometimes even emotional because sitting down with these people, and it's not a feeling that one will want to have. Like, it's, I don't know how to describe it, but it's something touching. And so wanting to be part of a group that controlled this situation was one of the motivating factors that got me interested in it. When I got involved in river blindness work, there wasn't a medication that could be used on a large scale. The main strategy was to kill the black fly. But if you're going to kill the fly, you'll still have the parasite that causes the disease in the people. And the adult of that worm can stay for between 12 and 15 years. So the strategy is you kill the flies for as long as the lifespan of the worm. Then by the time you stop your insecticide treatment, there won't be any worms left. In 1987, then the medication Mectizan was introduced for human use. The drug is produced by the company Merck and Co. Incorporated, and they decided to give the drug for as much as needed and for as long as needed. that was unprecedented in the sense for a pharmaceutical company to want to give a drug as a donation for millions and millions of people. And the moment that the community members were given the opportunity to distribute the drugs themselves, the treatment numbers just skyrocketed.
Bonjour tout le monde. Ce n'est pas une campagne qui est à bafouer. Nous devons s'y mettre pour au moins bien dérouler notre campagne. Il est là ici. Par la voie orale. Le nombre de comprimés à donner dépend de la taille. Ça, c'est de façon très claire. Hein? Plus de 160, la personne aura 4 comprimés. C'est de façon résumée, un site de distribution. Et maintenant, dire à la communauté, nous serons là à telle date. Pour que les personnes s'y rendent pour au moins en bénéficier les médicaments. Comme on est entre nous ici, on va dire la stratégie que nous allons adopter. Vous avez plus d'expérience dans ça, quoi.
Campagne ko wowi wadde ko comme porte à porte. Comme c'est fait, porte à porte wowi wadde. Pour si tawi faut ko e bénéfice.
Gollo ɓe e wonɓe arde ɓe. Golle ɗen kadi mi sikko ɗon kadi ɓurata wadde sir.
Wawata jonude résultat mo faala ɗen on. So wi yo ɓe ar woɓɓe ɓen arata. ɗum kadi ko ɗum ɓeydayno e toon.
waɗen campagne on déroulé mo normal heɓen attendre ko landaɗen kon par ce que koye dañi koye fin wonde eyyi.
Ben, nous, on va adopter la stratégie porte à porte. Hein? Ainsi que votre déplacement, surtout, ce n'est pas évident de faire déplacer une équipe. C'est de clôturer cette orientation.
OK. Merci.
Souley, est-ce que dans l'année que nous sommes entourés? Hein?
Moi.
Pakai dia tu dah masuk je, mama ho nama. Borong oto do.
Fakir ma yar go kasel.
Alhamdulillah rabbil alamin. Wasfat albarka.
Ni alman. Kaka mo mengal. Menen no dio. Fi no wadi campagne ji wondo arde de balde arawje do. Haalindirane yewtide e makko torodem. Pour no yarira ko nafoore men wala yiya woɓɓe koyngal ngal no ɓuuti no wayi koyngal e koyngi tawa koyngal ngal no ɗumanni no tiwri ko ɗum woni ñabbu woni mandeji mum ay si ɗum ala ene wiyen ɓuuri kadi ɗum kadi no wona ɓuuri tawa ɓe wiya no jippi tun e tagaɗo
anen ko on ɗum si tawi siko jam la joni mbay no conscieno ɗo almamino ɗo o wiyta juro koye haalda jongalleji ɗi
jongalleji ɗi haalnaɓe te
enen ni ko nakke ñama ka ɓa hoggo ɗo joni
min fuɗɗo jonirde hannde eyyi wari tawi ɓe haali wari ɗon yiɗɗe balɗe ɗo fof hiɗen ɗo hiɗen jindudude ko sen fuɗɗi ko jonirde hannde ɓe yii no wonna hendorede après noon si ɓe kamɓe ɓe wawa ruttade kaka poste men iwri ni normalement wari o gandi kaka chef de village o gattorte
ɗone kaka tawi mo haade o ko ɗon jogui nombre comme pour mi ko yarata eyyi ɗone ko ɗum noon ɓeydara ɗon
Asana ndeyata seeɓe
yara nayyi nan
ɓe mano ɗo ok
e secondaire on wuttoto ko hôpital noon eyyi on eɗen andi eɗen ko ɓuuri hewde kon fayda ko ŋaña
joni sabaudi koye ngol ɗo ɓe hata jonde lekkele ɗen ok haray joni kon ɗum e sikke mum joni haray ɗo par toujours
Allah waɗi jokkama ha tawama fewn ɗo ngu iwi ha hande kadi minen ko woni e miijo amen ko meɗen waɗi volonté kam min wanno meɗen eɓɓi dandude yimɓe amen jeeyaɓe ka commune amen ɓe kala nde wiyangu feeñino ko goɗɗo minen meɗen ɗo pour haɓagol ngu eyyi
comme woni chef de groupe Saliou Touré.
This is Souleymane Sagna.
Ahmed Lamine Ba.
And this is Mamadou Lamine Ba.
Satene Ba.
And Satene Ba.
Okay, thank you. Today, I'm going to talk to you about the work that you have been doing. I myself, I have been collecting like this for a very long time, for almost 40 years. Sometimes you might think the work you're doing is not very important, but it is very important. It is the work that will tell whether Senegal has eliminated transmission, and the best way to show that the disease is gone away is to look at the fly. Next year, there won't be any treatment, but your work will continue because we need to know that the disease is not coming back.
yeɓen heɓu hen goɗɗum kono noon so woni a wiyama ɗum ɗo ko gollirta ɗum ko saabu ya heɓu dandude hoorema ñaw danda kawtanma danda population ma on.
The children tell us how it is now, but we have to take the surveillance seriously so that we don't revert to how it was. I think the ultimate goal for anybody working in the health sector is people free of diseases that are preventable. And that concept of health for all, that is what I will wish to see in all these communities so that they can achieve their utmost potentials.
yemma mi welto harjetuli khadi mojiba salaw bada yemma salaw bada yemma kamota ene ndade dungal ma
Thank you all very much indeed for your attention to that. I hope you have a sense of what it takes now to reach that disease elimination. And now we're going to get into a panel discussion with some very interesting and diverse perspectives on how we can best support that. Please join me on the stage, my panelists. Thank you very much. Please give them a warm introduction. Thank you. Welcome. So to introduce everyone, immediately on my right, we have Desta Lakew, who is the Group Director of Partnerships and External Affairs at Amref. We have Salija Burks, who is Head of Strategic Partnerships for the Wellcome Trust. And we have Gaurav Gupta, who is the Global Managing Partner at Dahlberg Advisors. Thank you. Before we jump into sort of questions and perspectives in our day-to-day, I feel like after watching that, I'd like to ask you all, if you can, just to share a brief reflection on the film. Perhaps there's a theme or a moment, something that jumped out at each of you and resonates for the work that you do and perhaps why you do it. Desta, if it's okay, I may start with you.
Sure. I hope you can hear me. Sure. Thank you so much. It's such a pleasure to be here. And I think for me, at Amref Health Africa, we work very, very closely with the communities at the heart of everything that we do. We work with countries in Africa. So for me, when I looked at this, it really resonated with me because of the power of engaging with community to ensure that we are able to make a change. We're able to make positive impact. In the work that we do currently, we work directly with communities, in communities. We work with ministries of health and governments to ensure that those things like neglected tropical diseases are addressed. So for some of the work that we do, when we look at this community effort and we look at something like an NTD, we consider end to end. How do we engage and how do we impact and how do we implement an end-to-end solution? So even in this film, you see that people are actually at the community level. You have to build awareness. You have to train. You have to show them what the issue is. You have to also give them an understanding of why it's important to be screened. You have to train community health workers at the local, at the ground level, so they understand what the challenges are. And then you have to be able to have an intervention. And if you saw in this film, they start with the community, and the community is trained, the health workers are trained, they go to door, they have an intervention, that intervention is then now achieved. And what do once the numbers are down? They actually go into surveillance. So it's never over. And it's so important because the lives that it affects, the loss of, not just loss of life, but production in these communities is so important. So in my view, and in the work that we do, for example, we feel like not only do we focus on community, but we also have to focus on the role of national governments to prioritize this.
Thank you.
So if I gave you an example, just a quick example, and then I'll pass it on. A quick example, in Kenya, for example, where we've been around for almost 7 decades, we work very closely with the ministries of health. And what we've done there is really say, how can the government take responsibility and really looking at the national health, coverage and saying this should be something that's covered by the national health insurance. So in 2024, actually, we included NTDs as a cover that the government should provide part of UHC. And if even we're able to do simple things like that, we can actually hope to turn the tide, because the investment governments have to make in order to cover this is significant. And then we look at other things, like you look at philanthropies and end fund. There are many African philanthropists that we can also tap into. And I think educating and having films like this to really show how important it is something that we need.
Thank you.
Thank you.
Desta. Sledge, over to you.
Yes, I mean, I agree with all of that. And collaboration for me is at the heart of all of the solutions we have. I think the film really clearly showed the role of so many different kinds of actor, including the private sector. And I think, you know, at Welcome, one of our big focuses is on that piece around the neglected. Where are there gaps? Whether it's disease gaps, whether it's research gaps, how can we, with our catalytic philanthropic capital, really help shine a spotlight on things that we are just simply not seeing at a global level? And how can we then work with actors across from community engagement, which is absolutely essential. We can't create interventions and innovations. The science can go nowhere if it can't be taken up at the community level and if there isn't that acceptance. So how do you work in that cyclical way? And, you know, for me personally as well, it's so important that we are working in a way that is proximate to the issues at hand. We are a UK-based philanthropy. We can't possibly know what are the country priorities, what are the regional priorities. So for us, how we partner and enable and fund the researchers that are in the specific countries where these priorities are identified and are undertaking the research in the ways that are appropriate for that particular context is really critical.
Thank you very much. Gaurav.
You know, firstly, great documentary. And when I watched it, actually what I saw was a process unfold, right? I know we were talking about a very specific and very important disease, but I also saw discipline. I saw people dealing with medicine hesitancy. I saw networks being built. And I think there's something about that which sometimes in my line of work, you know, you get frustrated by, because you know, I'm often asked to think about what's the value of this? How much should we be investing? How much, and we have with you thought about the billions of dollars that are saved when you do this right. But actually it's a total undercount. Right? Because I sometimes feel like, well, you just do the right thing and other good things happen as a result. And this is, I thought the documentary brought that out really well. I mean, you can imagine what happened during COVID when you build networks like this. What does that do for vaccine hesitancy that we saw all across COVID, right? Those same folks and that human capital and human connection that's built, that seems like really dynamic, right? And I think that's missing unless you take this kind of high discipline approach. So seeing that discipline and that focus, I thought was just an incredible takeaway. I'll just add one more. The thing that really struck me was when they said they're volunteers. Mm-hmm. And, you know, we're in Davos and you'll meet a lot of philanthropists and there'll be the same people who are also in the business tent, right? And I think we revere at times philanthropy and philanthropists. And I challenge everyone to think about what's real philanthropy. I mean, the marginal cost of a person's time who has to think about whether their family is being fed and is volunteering is a much greater philanthropist than the rest of us. And so that really struck me.
Thank you for that important point. And you mentioned some of the work that we've done together there. So back at the time when we all saw in the opening credits of the film, the Niger government celebrating, feeling like we have reached this point, we have done this. There's a sheer sense of pride there. And in order to tell that story, expand on that story a little bit more and amplify it, we commissioned Dalberg to look at, okay, so if Niger has reached this seminal moment, this unprecedented feat, what does it actually mean from a macroeconomic standpoint? What's the, investment case, big picture? We're here at the World Economic Forum, so there is an economic case to be looking at this problem as well. Could you speak to us a little bit about that kind of work and that economic case beyond the obvious social and societal case?
Yeah, and I think many folks have started to engage on this idea of actually bringing out that economic case, right? And what I'll speak about is some of the things that are often missed. So yes, of course, when you put less of a health burden and you increase economic capacity, there are all these great effects. But I think what a lot of people don't realize is the care economy the burden that sits on families when people are suffering, right? You have someone who is, I think we had someone on the documentary who was 40, 50 years living with blindness. The productivity impacts of that are not just theirs alone. There's a whole community that is bearing that productivity challenge as well. So actually it's often an undercount whenever someone actually does an economic analysis. So we took all of those different things into account and, several $1 billion of actual economic outcomes for Niger, that were calculated. But I would argue even that is a massive undercount. And I think that's because the people of Niger do not deserve to have their time counted at the value that existed 20 years ago and 30 years ago, right? Where the annual GDP numbers, and that is what we're only legitimately allowed to use because you have to create comparability. But from a humanitarian perspective, it's a total undercount because what you're actually doing is unleashing people's potential once you engage on these diseases. That means the economic value of that person itself should be rising over decades. So even when you hear these numbers, and I think the initial reaction is cynicism. It's my reaction sometimes. I'm like, where did this number come from? Read the fine print. Most of us who are in the business are forced into being more conservative than we actually want to be.
Thank you very much. If you'll forgive me, Desta, that reminds me of a conversation I had with my kids just a couple of days ago. I was getting ready to come here and preparing and packing, etc. And as they always do when I go somewhere for work, they're 4 and 7. They were asking, Dada, why are you going? Where are you going? From their perspective. And, I told them, I sort of tried to paint a picture. I've talked about my work to them. But because they're 4 and 7, I have to simplify it. And, that often finds me thinking of the power in simplicity. The word innovation is in our title today, but that doesn't have to mean complexity. That can be boldness. That can be simply doing things differently, but being the first to do it, taking that chance, taking that step. And Desta, some of the work that we've been very proud to partner with Amref on, and I know that you've been doing for a very long time, is around building the capacities and supporting governments locally at different levels. At national level in Kenya, you have a decentralized model, so county level and even beyond that, to build the capacity for advocacy for this and to support the development of the right mechanisms from a policy perspective, from a financial flows perspective in the Ministry of Finance, etc., to ultimately result in greater domestic resource mobilization in environments that resources are very scarce. Opportunity cost is very high for every allocation in a government budget, and yet you've been able to get government to pay more attention to this issue for some of the reasons that we're starting to hear about. Could you talk to us a little bit more about what it takes to do that work and why it's so important?
I will do that. Let me just come to one thing that Gaurav said. You said these people work for free. All community health centers. In Africa, community health workers are not compensated generally. A majority of them are women. And so, therefore, when they do this work, it's for free, basically. They're identified by their community. They work within the community. They have the trust of the people. So when we as Amref work in the community, I mean, if you look at NTDs and the interventions we're doing here, for example, on NTDs, it's the same basic structure, right? Who do we engage within the community? Because unless the community is involved, things don't happen. So in Kenya, it's a devolved system, but in other African countries that we work, it's not a devolved government system, right? So what we have to focus on is making sure that we look at an end-to-end solution. It's a standard. If it works for NTDs, it will work for NCDs. It will work for everything else, right? So the way we've operated is on the care side, it's really doing health education, it's doing demand creation, it's doing screening, treatment, etc., end to end, right? So that's at the community level. But at the government level and the partners that we work with, such as Welcome and others, it's really around how do we build evidence, gather evidence, so that that evidence can actually impact policy and that governments can see and policymakers can see why it's important to actually prioritize this. Right? So we actually have a standard system that we're working for everything. And NTDs is one of the most important things because NTDs does not get money, does not get funded. And oftentimes, yes, donors, philanthropists come and they say, well, this is very expensive. I mean, I've had people come and say, really? You know, we've kind of figured it out. And it's about $20 per person. In India, I could do this for $2 per person. And so there is that lack of alignment to really understand what does it mean. Do we have roads? How do you get to the community? How do you do that? So we need to really shift the way philanthropists think about their giving. And if innovation, by the way, innovation in this case, there is innovation. If we look at the work that we're doing and we say, how do we do precision health, community health? That's innovation, right? That's something that philanthropists can really understand, because you're really looking at how do we gather data to make an impact. So there are some innovations that we can use, but by and large, the way we've worked and operated is through partnership with academic institutions to do data gathering, partnerships with research institutions and organizations that fund that, to ensure that we have we are able to prioritize and instill that. So really, those are the kind of ways we work. It's not new. It's something that we've done for almost 7 decades. But I think what's important is to say, this is what philanthropy looks like. And it's not just a global north to south movement. It should actually be global south and north movement to eliminate something like an NTD in any one of our countries. And I think that is something that we need help from you, for example. Saleja, right? How do philanthropists get together and communicate? Where is the Global South voice? Why are we having this conversation in Davos, for crying out loud? Mm-hmm. Think about it. Mm-hmm. So we really need to look at this and say, if this is a global, where you don't have Global South participation. And those are the kind of big themes that we have to look at.
Exactly.
Yeah.
Thank you, Desta. I feel like you almost asked my next question of Saleja, which is, of course, representing one of the larger philanthropies out there globally. We've heard a little bit about the trust, the relationships, the desire to do things differently. At the End Fund, we represent thousands of philanthropists from, sort of the Gates Foundation at the very top and a few others in that strata, all the way down to individuals who, feel compelled to give $1 at a time. We want to make sure that there are pathways for everyone, because the tent needs to keep growing, as we see through the film here today. But as one of the biggest philanthropies, you've done so much. We tend to focus on funding delivery at the End Fund, because so much of it needs to happen, and that's a place that we've leaned into. But there's so much else across the spectrum of research and development that Wellcome Trust has really led on, and in particular, and to bring it back to some of the broader themes here in Davos for several years now, the impact of climate change on health in particular is an area where the Wellcome Trust has really led on in recent years. So I'd love to hear your perspective on that, and how the priorities that you're setting and seeing relate to the kind of work that we've seen here today.
Thank you. Yes, we are spending a lot of time and money thinking about that intersection between climate and health and infectious disease, looking at where there are escalating diseases and what we can do to prevent and control. So we're thinking about vector-borne diseases, waterborne diseases, drug-resistant infection. And, just to come back to the film, there was an individual researcher at the heart of that story. And that's something that, again, to that point of simplicity, sometimes the idea of funding science and research can seem super complex. It can seem like only a few can do it. But actually, at the heart of it, there are African researchers who need that investment in their early stages, their mid stages, and later. And so that's a lot of our focus, is supporting agencies like the Science Foundation for Africa, who are then funding specific research activities and really centering on what's happening at that local level. So that's a big heart of our approach. It's still a work in progress, and something that we'll keep thinking about how we can do that better, to your point, Desta, of really kind of localizing our work increasingly and knowing our limitations as a global north philanthropy. And I think on that intersection, we are trying to think about how we work across the spectrum. We sit at one side on the science and research side. We know, though, that if we limit ourselves there, we can't hand over, we can't engage those philanthropies that are able, and not just philanthropies, but public all the way through to private sector actors who can take the interventions and the innovations through to that scale-up side, and also thinking about access to innovations, which is a huge priority for us. So we've developed things like a Climate and Health Funder Coalition, which is about really kind of aligning across the climate and health donor community to understand where we're each funding, where we might be seeing gaps, and therefore for where we might not get that cyclical chain. But really just trying to get out of our vertical disease and vertical issue focus to think about some of those more systemic issues and how then it can link in with country financing, country priorities. And this is something that we're doing together with Amref on the kind of financing flows perspective as well.
Fantastic. Thank you. So you mentioned your partnership with Amref there. Desta, I know how trusted a partner Amref is. You've mentioned the 70+ year tenure. It's to those of us who work in the space, it's obvious. But for the rest of the room who perhaps are less familiar, the issue of climate change is something that's on everyone's calendar, I imagine, this week here. Everyone's going to a panel. Everyone feels like it's important. But can you help bring it to life in the context of communities that we've seen in the film, communities who are at risk of NTDs, many other areas of global health that are sort of operationalizing in the same areas, the same communities? Can you help bring it to life? We've done work together to highlight, and we know Amref is working hand in hand with communities to support adaptation programs in light of extreme weather events that are happening today, have been happening now for years, and that are directly affecting communities in a lot of ways, as well as affecting optimal allocation of resources to support those communities. And so could you just give us a little more insight into how climate change and extreme weather events are actually affecting communities, what it means for their risk exposure to the vectors that are carrying disease, and how people in this room, other partners on the stage, might collaborate more effectively to support that adaptation?
So that's a whole other event, right? Because the reality is the following. Health has never been a formal working group within the UNFCCC. So it is only in the last few years that in that conversation, health has even come up. It is only in the last, I would say, 3 years. In fact, Wellcome supported the WHO to even establish their facility there. So the challenge with climate is for Africa is, even though we are only emitting 4%, that's Africa's contribution to climate crisis, but we are actually facing the majority of the impact. The challenge then becomes, how do we engage with ministers of health and other health professionals for them to really understand what the language and politics of climate is? How do we ensure that health becomes prioritized within the formal UNFCCC process? We look at research in UNFCCC on climate, less than 14% is research that's conducted by Africans, for example. And yet we see the most devastating burden happening within our communities increasingly. A few years ago when we had COVID, for example, Malawi had a cyclone. And the president of Malawi said that one incident, that one cyclone, had more of an impact than 3 years of COVID. Because they saw waterborne diseases increasing, because they saw, so I think for us, the risk is, are we going to, even on things like malaria, which has investment, are we going to see rolling back of progress there? Forget about NTDs, which philanthropists and government are not necessarily prioritizing, but how do we ensure that the health system stays, that like the center holds? Yeah, I think that's the question. How do we ensure that the center holds amidst climate crisis, amidst health crisis? And the only way that we can really begin to do that is begin engaging at the community level. These guys in this film, imagine this. Who in this room is going to be catching flies as a job, as a volunteer job? anybody on this stage or in the room, no one is going to volunteer to catch flies and put themselves at risk because they're catching the flies on their body before the fly bites them. So communities are willing to go the distance if they understand what that impact is. And they should be compensated. And we should prioritize their voice, because at the end of the day, if we can stop it at the community level, we can certainly stop it elsewhere. And investment is needed.
So we've heard our call to action for the day. Thank you, Desta.
And that's not to catch flies.
So I'd like to perhaps zoom out a little bit and try to, we're getting towards the end of the session, and have a little bit of perspective and bring it back to some of the conversations that, again, we really appreciate everyone coming and getting an insight into something that probably you had no idea about before coming today. And, as we all are thinking about the prior event and this event and the next event and next week and next, the next days, and how it all fits together, what our key themes are coming out of the week, what we're going to say to our colleagues and our networks. Why is this conversation important? I'd like to zoom out a little bit. We've heard a lot about the role of philanthropy. We've heard a lot about the role of communities, a lot about the role of government, and a key sector, a key constituency that I think is important in this environment is the private sector in countries that are endemic for NTDs and other health challenges and who are being affected by climate change, as we've heard. And so, Gaurav, I'd like to come back to you. Through the expansive work that you do advising companies all over the world, but in Africa as well, what role do you see? I mean, you've talked about the economic upside of this kind of investment. Presumably, it's quite hard to articulate that generational return on investment, in a business plan or an investment case to an investor sort of, today or looking forward over the next 5 to 10 years. And so can you talk to us a little bit about, first of all, how we can do better at making that argument, but second of all, the role of the private sector, because ultimately we're talking about the health and well-being and prosperity of their customers. And what is that connection?
I think the temporal arguments about, you're doing something that is going to reverberate for the next 50 years, I'd give up on that. It hasn't worked, and it's not worked for climate change. I think for healthcare, well, it's a tougher sell. I think you've got a coordination challenge which can be addressed. So right now, it depends on disease to disease, but for most of these things, there is pockets of value, but they sit with different people. So for no one, the pocket of value is big enough to fund. But the total pocket of value is enormous. So government, clear a reason for why they should be funding. They only have a limited amount of money, high value. There's an aspect that's often private sector. I mean, in this case, Merck gave it away for free, and I'm going to come back to it. But there is, for many, there's at least some sort of value that they can capture and so forth. And then there are different people who are impacted by the whole chain of events that any disease does, where there's value. Other businesses who would literally pay to be like, please take this out of my communities and where I'm working. But the value is sitting amongst all these different people, and the challenge is, how do you bring it together? And I think that is the one thing to crack, because that's actual real value. Philanthropists are just gap filling most of the time, or taking risk. And, their money is limited. It's meant to be high risk taking. And there is as many conversations about neglected diseases as there are about many other things, and everyone's vying for the same thing. So we're actually in competition with each other. I think the trick is for philanthropy to figure out how it can really crowd in all of these other sources of value and make it known and form the mechanisms like they have quite successfully, right? At times with forward market commitments, at times by bringing in other researchers and forming those collaboratives to actually get to the drugs in the first place. Those are tapping into new pockets of value. But I will say one thing. I mean, there's an example in the river blindness one of Merck. I mean, Merck's got a factory that's all it does. It's not a side hustle in terms of we're using spare capacity. There is dedicated capacity just 24 hours to make this medicine. Now, there is no market force that is going to make you do this. So the question we have to ask ourselves is, what are those moments that we can create in many of these companies to also get on board. And I think if you talk to Merck today, they'll tell you that it's a big part of even their own strategy for attracting and retaining talent, which is a cutthroat aspect of the pharmaceutical industry. So they see that internal payback. But it's places like Davos where a CEO turns up, not that many are turning up this year, but a CEO turns up and they feel like they have to make a commitment. And I would encourage philanthropists to push those moments. Because when I have spoken to people in pharmaceutical industry, the only reason I get sometimes is, well, we made a commitment. That's the only reason we're doing this. It's public, so now I have to do it. So find ways to get them in front of a camera, work towards their ego and their need to say something, and get them to make some public commitments on this stuff.
Thank you. I think we have a response here.
Yes. Well, I was just thinking one of the things that we're, a moment of positivity in this space, thinking back to 2017 when we helped with many others launch CEPI, and just a really big success in the NTD field. Last year was the first ever vaccine approved for chikungunya, a mosquito-borne viral disease. And just to say, I think that is one of those examples where actually public and private have really come together and found that space, thanks to a commitment made in spaces like this. But I think it's just keeping going and knowing that actually progress is possible. It can feel unattainable, but actually you can bring those actors together to make some real changes.
Thanks for giving that example. And I think bringing up pharma is critical. They're the remaining investor in the sort of grand equation to help make all of this happen that we haven't really spent too much time talking about. The extent of these commitments are real, they are enduring, they are hard-earned in many cases, and it's with thanks to Merck in the US, Merck in Germany. They are a really interesting model where not only are they looking at a donation, but they're investing strategically to look at how they optimize the effectiveness of that donation. They have strategic investments in supply chain and monitoring and evaluation and learning, several other areas to help make sure that they're learning as they go so that they can continue to evolve how and where and the extent to which they donate. Johnson & Johnson, Pfizer, there are many other companies, GSK and others, who are here this week. So it's important to mention them as co-investors, principal investors being government, as we've heard, because the commitments in terms of human resources, in terms of infrastructure, in terms of policy are, talk about an undercount, they're never counted. They're never valued enough. Perhaps they are sometimes, but never enough. And that's something we need to do more of. The value of the donations, the value of the philanthropy, the value of the commitment, which is immeasurable at a community level, though does deserve compensation, as we've heard. These are all critical parts to think about. And I would encourage all of you, as you're thinking about how this work, these kinds of collaborations manifest, how they affect perhaps your world as well. Desta, I'm sensing you have a comment.
I do have something. I know we're coming up to time. The thing is that I think if we look at private sector, for example, we always talk about there is a gap. Private sector has a role to play, but we have not told them what that role is. So I think that part of it is our challenge also, right? What is the role of private sector? How do we ensure that they understand what their contributions could mean and could be, and the extent of transformation they can actually be responsible for? So I think we as collectively need to understand what is the role of private sector in ensuring achievement of universal health coverage for continents like our continent, right? That's number one. Some of them have it. Some of them understand. So yes, there's product contribution is one thing, but the other thing are things like what GSK did, which is 20% reinvestment initiative on the profits that they make on the continent. And that goes towards training of community health workers, right? So there are different ways to do it, but I think we have a responsibility also to engage them on that. So that's number one. Can I just go very quickly to philanthropy? Because, I am here with my friend here.
Of course.
Yeah, let me just go really quickly onto philanthropy. So for example, we talked about climate and we talked about the fact that health is not part of that discussion. But there is financing for countries, for climate interventions, right? These guys are working with us, and we're trying to get, for example, in Africa, we're trying to get leadership in a common position for Africa and the Africa Group of Negotiators and Ministries of Health and Environment and Agriculture, etc. The interesting thing about that is that countries at country level, they need support. They need technical assistance, right? To be able, thank you. They need technical assistance so that they can actually have their national adaptation plans completed so that can actually give them access to get funding for not just adaptation, but for mitigation as well. So we can we can look for support from philanthropy, from private sector to provide technical assistance so that countries can align themselves and do the needful so that they can actually qualify for funding, green climate funding. Thank you.
Thank you, Desta. So I know we're approaching the end of our time here. Thank you all for your attention. I'd like to just ask for a quick final remark. Any burning issue or perhaps one of the things that has risen to the top in terms of importance for you all, for this audience to take away today? Gaurav, can I start with you?
Yeah, I think just one thing that, a lot of these diseases, and I think it's really interesting what you've managed to do with river blindness, is we're entering the treacherous zone, right? Which is the treacherous zone is now it's nearly there. We're nearly at elimination. So going to that extra person is costing so much more. And that does not survive political patience, right? That does not, there's so many people who suddenly then start to turn away. Right? Not recognizing how expensive it is to bring all of that back. And so I think that's one thing I wanted to comment on the philanthropy side. Philanthropy should be the brave, the patient, the guys that do the stuff that no one's willing to do. And I think this space, especially as we're entering this, what I call this treacherous zone, where it's just all of the incentives turn away from institutions to just finish the job. I think it's really important that we keep putting that pressure on.
Thank you. Saja, as someone who is brave and patient and has the resources to do what nobody can do, over to you.
I'm not always very patient, but for me, the big word here is neglected. And I think there's something about language. Firstly, storytelling. I think at Davos, it can feel very theoretical. Everything can feel conceptual. We use the same words 10 times over. And sometimes the reality can get lost. So I would just encourage us all to take the story that we've seen and really remember what is happening for communities. As a Sri Lankan diaspora person living in the UK, that is kind of what draws me to this work, is how do you center and keep that live in your mind? So language in that perspective, and language in terms of how we connect across sectors. I think we're often afraid of the private sector. The private sector is often afraid of the conversation around community engagement and what it really means for individuals. So how, I do see that as a role of philanthropy, but I see it as a responsibility for all of us to listen to the way that we each show up in these spaces here and try and use that to broker the language gap between us so that we can develop solutions together.
Thank you very much. And last but not least, Desta.
Thank you, Sam. For me, it's the storytelling angle. So I think what an extraordinary job the End Fund has done with telling this story of river blindness. And even the title, The Fly Collectors. This kind of information, this story could never be so widely shared if the End Fund had not put it together. And so I think we have to continue to tell the message. You're in an excellent position, and you frame up the situation for us in a way that all of us can align around this. So really, for me, the takeaway is we've got to continue to tell the story, give the message, and End Fund, congratulations to you. What an extraordinary piece that you've commissioned.
That's very kind, Desta. Thank you. So one final thank you to all our panelists today. Thank you to everyone for your attention, and we look forward to engaging you. We'll be here for a few more minutes, so please do ask questions or connect with us afterwards. On behalf of the End Fund, all our partners here, on behalf of the communities that we support, thank you for your interest, and we look forward to continuing this discussion. Thank you, everyone.
Thank you, sir.